you'd be a fool, I think, to try and predict when we'll be completely through this crisis in Victoria, but at least hopefully in the next week or so, we might start to see these numbers come down with stage 4 restrictions sort of having had an impact on the data that we're seeing. But the most disastrous number that we've seen today out of Victoria is this one, 15 more deaths. Australia's deadliest day through this pandemic. Again, we're saying that's broken another record, set a new milestone, and it means Australia's total death toll through this pandemic is now 247, and as you can see, the vast majority of those now are in Victoria. Today's numbers have also pushed Victoria over this line, and now Victoria has more deaths per capita than any other state or territory in the country, up there with Tasmania, which also had a very devastating hospital cluster earlier several months ago. So that is the state of play in Victoria, and sadly we're not really seeing these numbers slowing down. In terms of hospitalisations, we had something in the order of 82, I think it was, or 80 or so new people, more people in hospital today, so 538 in total, of which around 40 are in intensive care. This line is so steep it almost appears to be vertical, and it's just not slowing down. So I think we are likely to see more days in the future, which we are going to be calling Australia's deadliest day in this pandemic. That's the brutal truth of this. In terms of the infection numbers, 725 is again another record today. We are seeing very big numbers. It's only too high than the last record of 723. This trend is still heading generally upwards, and probably, you know, even though we had some comforting days for the last couple of days in the 400s, probably this trend will keep going up. It is still climbing, but slowly, and we'll probably keep seeing that until stage 4 does start to have an impact on these. We have every expectation it will, given how slowly these numbers are climbing. That extra pressure of having more people staying home, many fewer people out on the streets, that should, you know, it would be reasonable to expect the pressure to tip over so that that curve does start to bend. At least that's the hope. We really do, for everyone in Melbourne's sake, hope that starts to work soon.
Yeah, absolutely. Elsewhere in the country then, Casey, Queensland is closing its border with the whole of New South Wales and with the ACT as well. Take us through the reasons for that decision in terms of the infection threats.
Yeah, because it's, you know, if you look at the raw numbers, one new case in Queensland today, that almost seems like quite a lot, quite a big move. Basically, Queensland said we've got a little bit of community and local transmission at the moment. We want to get rid of all of that and stop it ever coming in again. Queensland, as well as South Australia and Western Australia and Tasmania and the like, are all being very fiercely protective, and they want to keep local transmission at zero for as long as possible, because that is so much easier to deal with. Hence a closure of the border, not just to Sydney and Victoria, but also anyone now living in New South Wales and anyone living in the ACT. And that's, that jurisdiction's almost become collateral damage here, because there are no active cases in the ACT. It's just that at least one person has used Canberra as a sort of intermediate stop on a journey from Sydney into Queensland to try and evade the border restrictions, according to Queensland Police. And so we're seeing measures like that, borders coming down hard and fast. We've also now just seen New South Wales requiring anyone coming in from Victoria to New South Wales to go into hotel quarantine at own expense for a full fortnight.
Looking more closely at New South Wales, then we can see from your screen there 12 new cases overnight. Any reasons to be cheerful? Because we need them.
Look, I actually am feeling, maybe not optimistic is the right word, but New South Wales is sort of holding the line in a way that we do like the look of. 12 cases, 11 of today's are locally acquired. Only one of those has an unknown source, so still the vast majority of cases getting tied back to known clusters. And you can see here, these numbers have been very sort of stable, very flat. I like to look at the 7-day average as a way of sort of smoothing out, just to get a clear idea of the trend rather than having all of these peaks and valleys. And what we saw is, for the last couple of weeks, it has been growing, that 7-day average has been growing extremely slowly, from sort of 10 to almost 15 over the period of about 2 weeks. With today's numbers, because we've had these smaller numbers for a few days, it's now shrinking exceedingly slowly, but still shrinking nonetheless. So we hope that will continue in the days to come. We hope we don't have another big cluster, because obviously these two hills are sort of linked to big clusters that blew up very quickly in Sydney. If we don't have another one of those, well, we should be hopeful that these numbers will start to come down. It's going to take a while, I think. It's going to take some vigilance, and it doesn't mean people in Sydney can ease off the brakes or be less vigilant, but at least things are pretty happily not going in the wrong direction and showing the very, very earliest signs that they might be going in the right direction.
Casey, thank you.